Yeah, Busia, you're all welcome to today's episode of My Health Checks. My Health Checks, saving lives with my honorable doctor, Bobson Ateko. Nedwumadi so ampaye bedwa fi say yade ahodo a ya edokoro yen titru ne yempanyin no. Eno wasem ene eba bekan. Na ansa na mehyia ase no mamemfa na ase sonko na ase a eni kabea. Emfa ma boafo ya agya mo dom me so masene. Emma metimi ne dwumadi ebro ma won so unya enkwa fi say wo ahoden a na ke say wo nkwa. Na mimusa we ansa na mabaso. Empra hene ena wankasa udi America ekọ wo doctor ho say doctor ene de me pese me hwe mapomudin mu odofo emperador sign ena wakọ. How many times do you visit your doctor for a check? Sa dwumadi ayinti anase esu ene eba nti a yentu anamontem ewo yapomudin ho nti da bia ye kwa ye se oh wo ba wo yanka wo ba ntem a anka bia enu sei enu nti ena my health checks nso ye de abrɛwo me doctor ya make na se me say wotu ne ho asi ho se de ebe ya obekyerɛkyerɛ yen yade bia ne ho sam yade bia ne se de esi ba na eba so a anamo ese utu se wo fie se wo hene anamo ese utu enuane ese udi enuane ya ense se udi eno ena my health checks e de ba be guide wo se de na obe hu ne nti a esese nkohuno wo doctor ntɛntɛm pa so na wanka nkyerɛ wo mpo sɛ ayɛ too late. Ɛnɛ dwumadie nkurɔfoɔ dodoɔ bi asɔ masene. Golden Palace Hotel Limited wɔn mo asaman kɛse. Wɔn nso so ɛwɔ event center yɛ a yɛfrɛ no sɛ Lily M Palace Event Center. Ɔlɔfo sɛ bi ayɛ programs biara. Asaman kɛse Jamestown foɔ so menka nkyerɛ wo sɛ ɛmfoɔ ne nkyerɛ baabiara sɛ Lily M Palace Event Center. Na meka we na me kyerɛ wo so sɛ wɔn numbers egu screen na se. Mesrɛ sɛ uhia wɔn mo a na you just give them a call and they will also assist you. Steamer Records under Steam Limited and as a Steam Group of Companies. Yeah, Steamer Records shim. Omada wo madom boa me eso masene mame de dwumadie ebrewo saa nso so na hairport salon me say see the way dear maka kire me ho say me say me rock baby pink na ekọ color ye egu miti so ne haircut simple haircut down cut me look so simple every hairport salon na hairport salon no enye haircut nko na ono mo ye etire bia ma ho ye fa bia say oye oba say oye bema hairport salon omo be hwe kama. Lily's Bead Hub. So one say me come say de me come kama African bead, natural beads. Any earring get sham fefa. On the floor, if Lily's Bead Hub. Lily's Bead Hub dear. Bibia fa bead hu bia sabe. Sa wo di gu wasene mu. Sa wo de to kom. Sa wo de hye won sa wo nan ho beads. Beads bia ye African beads bia no. Mesre say for one chere Lily's Bead Hub na omo numbers no so egu screen na se odofo frɛ onom na onom ema won so ho nye fese wankasa mo song stress ba ko pɛ ya me na dwumadie yi me de ho chia me se me dia ne afro song stress Lily M obetumi so afrɛ me Maame Colors bi nkwa me ne wo ba me se Colors de ɛho hia pa fi se enkwa nkasa ɛho hia odofo me hu me su na me ka kyerɛ wo se nenso yetira ye me doctor say abrante kwa ya wasua de yie na ode adesua no mu ne wanya afiri mu e de beboa wo a wo hwɛ me ene me amete hei se de be ya be hwɛ ya pomuden so yie nti nanso me doctor ba fie ha o se ne nante se ya ne se ye besua diabetes ho asem e ya de a ekun ye dodo e se ya brabo e shorten your life enu nti doctor say obekyerɛkyerɛ yen sɛ de be ya ye behwɛ ya pomuden so yie na yankonya saa yade yi bi. Dr. Bobson Ateko my adorable son.
Yeah.
Ma wa akwaba.
That's it.
And then so what's an abe fiase?
Yes.
Mo why dear pa so what two wants see ho. Doctor, said the makano. Diabetes. Any idea nya. Etiti abrabo.
Yes.
Na me pese busa say diabetes senetie yare ben no.
Okay. So Michelle will be once again.
Okay.
And me that say and that should be once me start akwanya we say me no babenya nkita hodie we.
And so me that say you fro bi a wo ba. Oh yeah dear.
So diabetes
Okay.
say that you can no. So diabetes yare bi basically no it is characterized by persistent hyperglycemia. Me breaking it down you can't hyperglycemia just say blood glucose and our blood sugar level no it will show persistently and then it lead to diabetes no
Okay, so blood sugar no
persistently if it is high persistently
just a brano bia na ekosoro. Okay.
But nyoma bi ohonoma ntia because ideally no physiologically say what did you wear and I say udi ejani bia na it has to go through the digestive process no the digestive is converted to glucose now glucose sugar na make glucose no and I was say circulating throughout your blood now every cell and every tissue in your body needs the glucose in order to produce energy and this glucose is supposed to be pushed into your cells and your tissues for your tissues to utilize it for glycolysis now so that they produce energy but in sometimes no the movement of the glucose no into your cells no becomes a problem. Make causes some of the problem but basically what happens is instead of say glucose never cause your tissues ni your cells ni now after they aka emoja nim persistently no say emoja nim it leads to a lot of complications persistently. That is where the major problems come from. One of the major things I want to say, it begins to destroy our blood vessels. No? The amoja vessels no amoja starts to say blood vessels. No? Now, fiti hono, it leads to a lot of complications. So, basically, it's supposed to be converted to glucose. Like that's the basic unit at the end of the day. The body never utilize it as much glucose as utilize it, but intimate utilizing the rest to be stored in other forms. Basically, most of it is stored as fat in adipose tissues. And that is where the problem. So, say glucose no, it me metabolize So, what break it down? Acoustic glucose. The metabolism of glucose no, it's a problem. That is where usually people get predisposed to diabetes. That's it.
I see. Mimusa na age bia o timinya diabetes no.
Oh, yes. So essentially, diabetes, no, your type 1, most clinical settings, most of the cases are is like type 1 diabetes, type 2 diabetes, a very big gestational diabetes, that's diabetes in pregnancy, and secondary diabetes. Usually, type 1 diabetes, usually starts in Korea.
Type 1 is starting in Korea.
Because there's a genetic predisposition most of the time. Because of some genetic units, akwara no yeba no the insulin production activity no so like there's a problem. Ideally the beta cells of the pancreas is supposed to produce the insulin. But for such people there's insulin deficiency and I say insulin producing sakra. That's usually what causes the type 1 and the type 1 no. The type 1 most of the time I inquire starting from inquire brain. Like we was checking the blood sugar persistently high. So we was for fitting brain na almost 30 insulin. Insulin shots regularly because the produce insulin no like insulin in babium. And then you need the insulin. This is that make say glucose ne begu umojema or say insulin no na pia glucose no echo cells no tissue na that produce energy no. Nti insulin ni ho when to mean pia we name call cells name amount produce energy. You understand? At that point like you have persistent hyperglycemia. And they say glucose no be dosu moje nti in say more insulin shots no because beta cells need to produce say insulin shot all the time. That is the type 1 diabetes. But usually the type 2 diabetes starts in adult life, in adulthood.
A free age bang.
Usually the risk in Ghana,
Okay.
from most of the studies that I looked at, the risk increase after 50 years. But worldwide, the statistics is like from 42.5 years and above, that kind of thing.
I see.
So the risk of diabetes increase. But usually, especially for the type 2, when it starts and is asymptomatic, you may not really notice any symptoms from the start until like it gets to some advanced stages. So that's why usually it's recommended that like when you are doing a routine screen for someone, like it's important to just check the sugar in addition. Like a routine screen, maybe I normal screening for someone, and I normal screening. One of the as an adult, one of the most important things to check is the blood sugar level. Because so even though the prevalence is higher in the, let's say from 45 or 50 years and above, young adults or middle-aged adults are also at risk. Even though the prevalence is not so high, but they are also at risk. And the type 1 diabetes is not so common. Type 2 diabetes, most cases of diabetes in Ghana is type 2 diabetes. And some are gestational diabetes, never diabetes in pregnancy.
I see. So diabetes in pregnancy. So
yes, one of my only diabetes, but offer due to some of the hormones that are produced, the growth hormones, prolactin, some of these hormones that are produced during pregnancy, can also predispose you to diabetes. So go only diabetes, but only offer na when that diabetes in pregnancy. But usually after delivery, I will say the blood glucose will go back to normal. For some people, it will still remain persistent. Even after delivery, still or develop overt diabetes after delivery too. And I was secondary diabetes.
And diabetes in the types and also.
When you can put there, it's just the most what is really common cases in Ghana.
Just the type 2,
type 1,
type 1, type 1 is common over Ghana.
Like a C, but as a type 2 is more prevalent than type 1.
Okay.
And type 1, type 2, gestational, and secondary. Secondary need a sometimes in Robo cause a persistent hyperglycemia. In Robo that's may predispose you to the diabetes. That's the secondary. So there's no problem with your insulin production. And I say but I didn't it Robo that's now I predispose you to the and I say sometimes some endocrine disorders which may predispose you to the diabetes.
I see.
And I say some disorders with your pancreas. Because in the pancreas they produce insulin. So if you have a disorder with your pancreas, it needs to predispose you to diabetes. So basically that is
wow, Doctor, why are there? But I Musa say, what it can be, but your lifestyle be. It mean my diabetes and I say quite be near fast was I had the enya. A aduane ho. A lifestyle. Obetumi aka ekwan fast wa bia betumi nya especially the type 2 diabetes na no. Obetumi abobbo ekwan fast wa etimi nya na on ehwe so na ya hwe yi.
So for the type 1, no matter what, mostly genetic predisposition. And also this is an autoimmune disease. It can be autoimmune. Most of the cases are autoimmune.
What kind of autoimmune now?
They can say like your own immune system begin to fight against your own cells. So in this sense, so like your own immunity, can begin to fight against the beta cells that produce insulin. So once one immune system can destroy the beta cells. Usually that's what happens in the type 1. So that one there. So in type 1 there's lack of insulin, another deficiency. Like we don't have insulin produced, and I say a craving I produce. For type 2, what happens is that most of the time the cause of type 2 is lifestyle.
Yes.
To say that about lifestyle. So certain lifestyle can predispose you to diabetes. And what happens is that your insulin, your beta cells are producing insulin all right. But the sensitivity, insulin sensitivity, that is the ability for the insulin to push the glucose, So insulin sensitivity, you have to even produce more insulin than usual before you can even accomplish some of the tasks. And also, it doesn't even work as efficiently as it's supposed to, based on our lifestyle. Most of the lifestyle, like sedentary lifestyle, you can say sedentary lifestyle, and I just say, the kind of lifestyle on your mobile, and now on ability baby, on anti baby, and I say on your active. So people who live very sedentary lifestyle, Otifakun, odidi no ada, moving ko baby da hosa. Those are that's basically a sedentary lifestyle.
Sedentary lifestyle.
Yes.
It causes diabetes.
Yes.
Okay.
See, that kind of lifestyle, everyone say you are being born into now want me and yet active, no, but still it can predispose you to the diabetes, that kind of thing. And see, lifestyle is very important. So sedentary lifestyle is one of them.
Okay.
Obesity.
Okay.
Obesity is one of the lifestyle. Clinically, the BMI say BMI, you know, you compare your weight to your height, and then they calculated the BMI. So if your BMI is personally above 30 now, that is
nice. You're obese.
Obese. Okay. So clinically, you're obese if your BMI is greater than 30. So in that instance, obesity also predisposes you to diabetes. Because several studies have shown that obesity decreases the insulin sensitivity. See, obesity never reduces insulin sensitivity, so that you have the persistent hyperglycemia and they are to See, obesity is also one of the major risk factors of diabetes. As excess alcohol intake, they said that make because alcohol will increase your caloric intake. It has it's with a lot of alcohol, you increase amount of calories in your body.
Alcohol calories.
Yes, increase a lot of
calories. Wow,
how? See, what happens? The alcohol is like about metabolism. The liver is supposed to metabolize alcohol. The same liver is supposed to metabolize your glucose.
Okay.
That's so if you are someone who takes in a lot of alcohol, sometimes like the concentration shifts to the metabolism of the alcohol to disregard of the metabolism of the glucose. No? So the glucose persistently elevated, it's not being metabolized. Now the liver focuses on the metabolism of the alcohol.
Okay.
Do you understand? That's how come your calories begin to increase.
Okay.
That's one of the etiologies. So persistent alcohol intake. And also another thing is alcohol be break on the because every time he's drinking. Okay. And then when you drink you become sedated. So it's like the diet becomes a little problem. So the person doesn't eat well, doesn't take in a lot of the essential vitamins way over here. Okay. So all those things will also predispose you to diabetes. So alcohol drinking, the sedentary lifestyle, medications, and usually the secondary diabetes in normal can predispose you. Those things can also predispose you to diabetes also. So basically, type 2 diabetes in the lifestyle.
Type 2 is a lifestyle.
Most of the time, a lifestyle. Most of the cases, no, lifestyle no predispose you to diabetes. If you don't eat well, like you don't get adequate rest, the obesity, like sedentary lifestyle, like everyone more deep asabasa, like just anyhow, that kind of thing. All those things predispose you to diabetes. So major cause of type 2 diabetes is a lifestyle.
Wow. And you say lack of rest. Sedentary lifestyle, that is when you lie down, you don't do anything. But let me ask you one question. She said, me yare, and I say, be yare be ademia to her. Not mean to me moving go baby, some of the faconam didi, na my family do didi. Still, met me diabetes.
Yes, with on your diabetes. So what happens is that, say, we will be or yare sana, we encourage you to be you ambulate more often. That is if you can. Obuonu say I want me auntie and I want me nye bibi auntie. They ben say or do better in no so e be born ho by free diabetes. That's what we do. So a bit more enduro a bit me increase your insulin metabolism and I say insulin sensitivity no. Auntie in that instance no so that it won't predispose you to diabetes no. Auntie when you be our na there are medications that you can be put on so that throughout the one more bit my area be 2 years or the horse auntie no. It puts you on some medications and to prevent it. So when you're diabetes, you know how to me so that is if you can't move at all. But even with that, as much as possible, be able to page and kakra, but than kakra. So with me and Nancy so Nancy kakra is very, very important.
Okay. You are watching My Health Checks, Saving Lives with Dr. Bobson Ateko. Makasa sa wo ba mi page so when what they say, over subscribe it. Now we now share because one share near can fam will be. And to YouTube, Lily MTV. In fact, all social media handles, Lily MTV, TikTok, Facebook, Instagram, and all my pages, Lily MTV. Then what say, over like page now why then na wa share said be ya won so ubetie de ye kan bi enne ne ye kan ho asem ebo ye man ekum ye maame nom ekum ye papa no enne ekum nkoda nso eye diabetes eno na Dr. Ateko enne ye ka ho asem doctor mesan mu akwa ba bi opa mo wa ya de na ede be na me hu a I mean science be na me hu a ese me suspect say because the time make us say me dofo bi ana me yonko bi aka kire me say o wa na ne nsa no nyina aye titiriti I say nam onya numbness ne nan nyina na ne nsa no I say atwetwe no enti me buta say sa nyama wo nyina ti mi ma onya diabetes and say science she say wo nya diabetes and so tell me the science of diabetes.
Okay, so you can some of the signs and symptoms. I'm putting them together.
Okay.
Signs and symptoms that you can have diabetes now. They said that you let me start from basically the earliest symptoms of the hyperglycemia, and I say raised blood glucose level no is polydipsia. I say insucomedy what I say.
Okay.
So you start with I say insucomedy. Timbia person no monsieur insucomedy bebre. Everyone so I'm out so bebre what I say nti you urinate a lot especially at night your friend nocturia nti won say you remember say wo dun so bebre ana insucom so tidio so be no monsieur bebre your friend baby polyphagia nti obo diabetes no omo ta didi bebre nti polydipsia polyphagia udidi bebre like o san dun so tentem what I say tentem
okay
nti ma udidi so bebre that kind of thing. Those are some of the early signs of the hyperglycemia no?
Okay.
If you have like numbness now some of the complications of diabetes no is the neuropathies diabetic neuropathies
diabetic neuropathy
just say like yarea affected or nerves no.
Hey doctor,
that's a neuropathy.
I see.
So a neuropathy just say like yarea affected nerves no.
Okay.
Diabetic neuropathy. The persistent hyperglycemia can cause damage to your nerves. So one of the earliest symptoms that you can have of the damage to your nerves is the tingling sensation. I'm referring to pins and needles. So pins and needles. Sometimes you get some of these tingling sensations at the bottom of your feet. I said there'll be the BB will I say when I see triction. Sometimes you can have the extremities on sun on such triction be sound. Those are all neuropathies. Sometimes I get to a point that like I won't say in canon because the nerves are damaged. Especially in the lower extremities no. Upra won't say wepra na aye crow. So was a crow no kese na crow no kese na didi kum na crow. Nti wadwe me baso no say wepra no kra na akro na then afro. That's what usually leads to the gangrene no. So now a lot of diabetic gangrenes like onine begins a pro. So one of the major complications of diabetes that diabetic gangrene nti persistent hyperglycemia normal on nerves are so weak like upra won't say wepra na a chrono ebeko so didi com na a pro so the leg become gangrenous when it extends, so sometimes if it's discovered early, like when they go to the hospital, the surgical team can start some debridement. Debridement, they can get rid of the dead tissues, so that to allow the healthy tissues to grow. They are starting extensive insulin, amount insulin, and in no so if it is discovered earlier, but usually it becomes so extensive, now the tissues begins to necrose, not a that's where the amputation comes in. So that's why a lot of times we tend to amputate a lot of diabetic patients because of the persistent hyperglycemia. And if you are diagnosed of diabetes, it's very important that in red you have to be on it. Like if the drug is causing any problem for you, see your healthcare professional. There are right now therapies for diabetes are enormous. The American Diabetes Association, there are guidelines, like there are several medications that you can take. Even if someone with liver impairment, there are medications that will be safe for you. If you have renal impairment, there are medications that are safe for you. If you have heart failure, there are medications that you can take to even protect you with your heart failure and the diabetes. So don't say because I'm going to invest in and it's very important to prevent some of these complications. Because the amputation is after amputation, people go into depression. Like it's not like you can imagine the kind of
depression and
mental states you are going to be in, even when you are told that you are cutting your feet. And I say even living with a rotten feet necrosis was a bone. If you go to the surgical wards, like one of the major things you see in a surgical ward, like especially in the male surgical ward, is diabetic gangrenes. We're kind of like money be brave, nothing proper. That's because of the persistent hyperglycemia. Bone one and I'll call regular checks to see say, if the diabetes, the blood sugar is being well controlled, that kind of thing. So one of the major complications. So the neuropathy now usually leads to the gangrene.
That's the diabetic.
What happens is that because of the persistent hyperglycemia, wound healing become very slow. So say for a normal person, if it take me just about 2 weeks for the wound to heal now, it will take you much longer. It can take you even about 2 months for until wound healing is slow. Also, wound is a and I also like you won't even do anything about the so the wound healing so begins to necrose. The wound can get infected. Gradually not necrosis near the beam. So that is one of the major complications, the diabetic neuropathy that leads to the gangrene and the necrosis. And that's one of the major complications of diabetes, and then it's very dangerous. I think like it's something that you should be very cautious about. I don't mean to scare anybody, but like
you are speaking the truth.
Yes, yeah.
So Doctor, I don't mean to cut you. Yeah. I mean, so what will I do? You know, if I'm sure somebody watching would want to ask this question, what will I do to prevent this from happening? Because they're okay there to get to this point means that what's now I late. So before I get to this point where my nerves are dead, and then I maybe cutting me cry, I don't have a feel of it, and then leave it to rot, then end up cutting my legs, off. What will I do? Because you need to tell people that, you shouldn't do this, you should do that. When you see this, immediately see your GP or whatever. So what will we do?
So generally, people who have been diagnosed of diabetes, you call something foot care, right? You are supposed to do regular foot care. So if you can do it yourself, you do it. Or if you have a caregiver around, let a caregiver do regular foot care. Foot care, what you do is that you assess the person's legs. So you stand somewhere that there's a lot of illumination, light or so you can even use artificial lights. Just regularly, just do foot care. Assess the person's legs. Assessing the 9 we only get to the feet to the 9 in between the toes near check under the feet regularly. So check from the whole foot, the calf down, especially like the toes, in between the toes, under the feet and all those things. Especially those who have been diagnosed with diabetes. Regularly do regular foot care. Make sure that there's no wound. So if you do the foot care and you notice a wound, quickly you start the management of the wound. So you quickly take the person to the hospital, especially if you have been diagnosed with diabetes, so that the wound can be adequately managed. You understand? Some of the wounds is just dressing that you have to be doing. Regular dressing of the wound to ensure that they heal quickly.
All right.
Vitamin C is very important in wound healing. So continuous supplementation with vitamin C. You understand? Take a lot of vitamin C and then regular dressing of the wound. With the help of the nurses, maybe the surgical teams, depending on how the wound is. You may have to even get to the surgical team to assist you, so maybe with a debridement. So for overt diagnosis of diabetes, they regularly do foot care. Very important to prevent some of these things. And in the amount, make sure you are always taking the drug as you are supposed to be taking. You have to regularly take the drug, and then if they schedule reviews for you to go for the reviews, you understand? Because when you have to be checking regularly. Say, is the drug working for you? You understand? And some of these medications can cause some complications, maybe some renal damage or liver damage. So the more you do the reviews, the more you notice that the drug is actually causing this and this. So let's change to this, or let's reduce the dose for you. Let's change to this, that kind of thing. So the foot care is very important. That one is basic, like at home. You can regularly be checked. So if you have a partner, if you have a grandfather who has diabetes, one of the best things you can do for the person is to do regular foot care for the person to make sure, especially if the person begins to have some of these neuropathies now. So when the neuropathies are coming in, that means like begin to check the blood glucose regularly. Now the glucometers are at home. It's easy to check blood glucose for your family. So you can be checking the blood glucose for the family, the fasting, and then a random. So for a fasting blood glucose, for someone with diabetes, you're expecting a target somewhere, say, less than 7. So for the fasting, I think we also less than 7. For a normal person, maybe somewhere
That was going to be
6.5.
my next question.
Okay.
Yeah.
Okay, so
If you have the glucometer in the house
yes,
and you
yes,
check,
yes.
then I bet you I saw rushy.
Okay,
I call doctor.
okay,
You know, you have the glucometer, you are
okay,
not feeling right. You want to, you check, and then you see that the number isn't right. So, but sign I say doctor, and sign I say so fun. I say, wow, your
okay.
home remedies and I
Yes.
baby.
So
Yeah.
for someone who has been diagnosed of diabetes, it means that now, you know, for a normal person, fasting blood glucose is supposed to be less than 6.5. So if it goes beyond 6.5, means that before you be diagnosed of diabetes, now your fasting blood glucose has exceeded the level already. Now, personally, your fasting glucose is maybe say above the 6.5, be at 8, 9, 10 persistently all the time. That kind of thing. Echo 11, 12. So not just say that. So when we put you on treatment, we are expecting the target to reduce to less than 7. That is our target. So if you are someone with diabetes needed or checking the fasting, if you are someone maybe 8, 9, yeah, but sanka maybe a free bar. I already 8 now.
Yeah.
That 8 is a victory for the person.
Okay.
So if I say it's supposed to be less than 7, it doesn't mean that. So we check a diabetic patient, now the blood glucose is 9, blood glucose is 10, and like don't conclude. That's why you need to usually they have pamphlets. You check it. You write your blood glucose inside. So Uber date, now at your date, and then you write it. So usually you compare with the previous glucose levels.
Okay.
The target should go less than 7. Do you understand? But it's a gradual process. Sometimes it takes a while before it gets there. So we want the target to be less than 7 for the fasting.
For the fasting.
And then we call something the random blood glucose. Random blood glucose is to check the blood glucose at any point in the day. Regardless of say we did it now or did you cry, like within the day, you know.
Obet check it.
Okay. And so what did you so the random is supposed to be less than 11.1.
Okay, that's a random.
Random, no.
11.1.
Yes. Okay. Less than 11.1.
And the fasting is
7.
7.
For a diabetic patient.
Okay.
It's supposed to be less than 7. And the random 2 is also 11.1. So that is the target. And you say we are diabetic now. Then above that, our target is to ensure that you get a random less than 11.1 and a fasting less than 7. That is our target. That's what we want to reach. That kind of thing. So there's another test known as the HbA1c. Those are basic tests. The glycated hemoglobin level.
Okay.
So that one also checks your blood glucose for 3 months prior. So about 3 months ago, how your blood glucose has been for 3 months now. That's also known as the glycated hemoglobin or HbA1c. That is also a very good indicator for the diagnosis of diabetes. And also, ideally, for normal people, it's supposed to be less than like 6.5. For a diabetic, we want a target less than 7. So usually, if people are diagnosed of diabetes, they do the HbA1c and all those things. So after we regularly maybe after 6 months, we do the HbA1c to see is the HbA1c or the glycated hemoglobin also reducing as well. So it's not just the fasting and then the random. The HbA1c is also very important among other tests. But the basic test, the fasting, random, and then the A1c or HbA1c or glycated hemoglobin, they are the same. Things that I used to check.
Wow. And doctor, and ya grow cry because some so I can also hear pa. They say diabetes there e kum nipa dodo. Doctor, a dear aduane na sese wodi. Na dear na sese wodi so we diabetic.
Okay. So when you are diagnosed of diabetes, your diet is one of the most important things. So especially depending upon the level of blood glucose me can like say we check you obi diabetic. Now checking a blood glucose. I was sure sometimes it can go as high as 18. Even can go as high as 18, even above 20.
Wow.
Some of the glucometers, sometimes if it exceeds the limit, they just write high on it. So they even write the value. So that want to tell you that it has even exceeded the threshold of the glucometer.
I see.
Do you understand? So in that sense, who of you now checking this and quickly rush to the ER. Now there's a regimen that they can do to bring it down to a certain level. Like emergency units. And I'll go to the hospital. Sorry.
You go to the hospital, go to the ER, and so what kind of ER? So the ER, the emergency, the hospital, they are all the same. So,
so there's a regimen that you can do, like put you on an infusion, a sliding scale, or Albertus regimen, not reduce your blood glucose consistently, whilst monitoring other things. No, about to me reducing gradually to some point. Now obafia, now the oral we not to us. So if you now check it, will be okay. We a caregiver. Now check it, the ocean the blood glucose. Now that persistently, like if it goes very high, like like 15, 18. Some
15 year, very high.
Yeah, it's high.
Not 12.
I mean, like when you get 12, it depends. That's what I'm saying. That it depends on where the initial was. At first, it was. So be an the blood glucose persistently 18 year day.
Okay.
Now after the we a target of 12. Like I mean, the person is doing well.
Yeah.
But our target is less than 7, so it's not good enough.
It's not good enough.
So it's either we review the person's medication. Especially if it's persistently 12 like that. We review the person's medication to check if the medication is actually working. So maybe we may have to increase doses, we have to add on other agents, and that's based on the patient's vitals, that kind of thing. So in that instance, like
so the food,
very good. So diet is very important for diabetes, especially. So sometimes those with like blood glucose very high or the glycemic index like the HbA1c all very high. After giving medication, refer to dietitians. Do you understand? Because the diet is also very important. So basically, if you can't visit a dietitian and other things, you can read about what is known as DASH dieting.
DASH dieting.
DASH.
Google
dash.
Right.
It will come like it
dash as in
dash DASH.
DASH. Dash dieting. Please, are you getting the doctor? Dash. Google.
Just Google
right
dash
now.
dieting. Very important. So they when you Google dash dieting, like it gives you dietary approach. It's basically for managing hypertension, but because of the relation between hypertension and diabetes, dash dieting is also recommended by the American Diabetes Guideline for like diabetes patients on diabetes too. So basically what you have to do is watch your diet very well. In the dash diet, they teach you how to incorporate more fruits and vegetables into your diet. You understand? And then the portions of carbohydrates, proteins, and fats that are supposed to take every day. So the Ghana Standard Treatment Guideline recommends that for a diabetic patient or someone to prevent diabetes, your diet, the carbohydrates should be just about 60% of your diet, and then you have about 15% being proteins, and then 20% being fats. But the fats, we recommend that the fats should be from plant sources other than animal sources, especially who has diabetes and advanced in age. We recommend that you stick to the plant source of diet than the animal source of diet. So the diet, so the fats 20%, the protein 15%, and then the carbohydrates about 60% of your carbohydrates. So generally,
like you reduce it to 60%. You don't. That means you need to take 40% of carbohydrates, or
no. You are taking 60%. So let's assuming the diet now, on the plate, the carbohydrates will be just 60% of the carbohydrates.
And also, is it not much?
And also, but I mean, like for prevention. For someone who has diabetes, like maybe your dietitian may probably reduce a little, but the carbohydrates, what do you do is that even the 60%, if you take more of the complex carbohydrates, so the complex carbohydrates, it is released gradually into your blood, and it doesn't push glucose into your blood. So the complex sugar, yam contains complex carbohydrates. Yam, the potatoes, fufu, plantain, all those contain complex carbohydrates. So for the complex carbohydrates, it is not released bolus into your blood. It's released gradually. So usually for patients with diabetes or patients with pre-diabetes, I didn't mention pre-diabetes.
So, and pre-diabetes, diabetes program now.
Well,
it's like it's so broad.
Pre-diabetes is a range is if you come very close to the range, you will diagnose you of pre-diabetes. So you say okay, can no. So pre-diabetes is the range when you come very close to the range. So you are saying that if your blood glucose is greater than for a normal person, shouldn't be greater than 6.5. But if you are someone that you are getting somewhere 5.7 upwards, and I just say so you may be diagnosed of pre-diabetes. So for pre-diabetes or people diagnosed with diabetes, the diet, that is what you have to your carbohydrate as much as possible, because in a certain Ghana, because of the kind of food they do are staple. The complex carbohydrates will be more preferred than the simple carbohydrates. To say simple sugar, table sugar, so for someone with diabetes, you shouldn't be taking a lot of the table sugars. You should take the sweetener.
Sorry, doctor. There's water, please. Drink it. Drink it, my dear. Let me also drink some water.
Sorry about that.
So the water companies, if you are watching, you can supply us with some water so we can also advertise for you.
So with the What was I even saying?
Yes, we're talking about you were talking about the pre-diabetes
Yes,
and
yes,
then
yes, 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 yes.
what
So
you
the
need to
complex
eat,
sugars,
the
no,
complex sugars, and
so
should
it's
stay
better to
away from
take
them.
some of these complex carbohydrates than the simple sugars, no.
Okay.
The simple sugars, you need to be free. Maybe over some of these juices, no, soda, Coke, Fanta, anyway, no, like they contain a lot of simple sugars. So no, no, it sort of shoots up your blood glucose. It gives bolus amount of simple because it's and you have to break it down.
A womb, a
Womb that it's being
a
absorbed.
shooting.
Yeah, shooting blood glucose. And so
I
the
see.
complex carbohydrates are more preferred because that one they have to be broken down into the basic units before they be absorbed. So 60% now make with the carbohydrate. It's preferred that you do the complex carbohydrates.
Okay, which is the potatoes, the
yams,
yams,
the
the
banku plantain.
the plantain.
Yes, so
They are all good,
they are
but
all
you need to add a lot of vegetables.
Vegetables, very good. So the proteins,
Okay.
the fats, so the plant source of fats like the pear, do you understand, the banana, all those things. You need the fats for your metabolism, but it is preferred that you get them from the plant sources, especially if you advance in age, like 50 years and above, and then you have diabetes, you've been diagnosed of diabetes. You prefer more of the plant source, not that you can't take in the animal fat, you could, but more of the plant source of fat.
Reduce the animal fat as much as possible.
That kind of thing. And then the proteins are important because like proteins increase satiety. Proteins make you full early. So it's like when you take in the proteins like amount mean them. So you don't even take in more food to increase your blood glucose level. So incorporating proteins into your diet, like we did amount me. So for someone with diabetes, your diet should be portioned. It's better to eat in small portions than to eat
in small portions
at a time. So
yeah, banku ni atai.
Banku 5 balls.
Na me be 3 balls na ya di we so ni atena faako. Doctor say you need get
small portions than to eat plenty at a time. So the diet is very, very important. So for very young children, like I mean, like it is important to look at the like for very young children, it's better to see a dietitian. So now unya dietary guidance from your dietitian or your pediatrician. So for very young children, especially those diagnosed of type 1 diabetes, that one is very important to get a pediatrician or a dietitian or draw a dietary plan for you to ensure that always, because dieting is very important in diabetes. They can't say cut dieting somewhere because it's very important.
Very important.
So another thing too that you have to know is that when you are a diabetic, now with the own so you have to, like for the caregiver, aside checking for the hyperglycemia, another thing, the hypoglycemia is also very important. So when they're going hypo is even more dangerous than the hyper because the hyper is a gradual something. The distraction is gradual, but when you go hypo, it's an acute setting, like it can be very dangerous. So the hypoglycemia, so if you're a caregiver, you're checking someone's blood glucose, especially the fasting, and the fasting is getting very low, like getting to 4. Less than 4, going less than 4 to say 3.8, like is like you are going hypo. So at that instant, you give the person some of the simple sugars. So at that point, that's where the simple sugars will come in. So if you have table sugar, if you have Coca-Cola or something, or glucose, some of those glucose powder now, which make some manufacturing, so called hyper. Some of your drugs can predispose you to that. And the bone normal because more diabetes, it means the cry was on the D.
No, we collapse cry.
So if it goes very low, less than 4, sometimes it can go even less than 3 point. I call less than 3.2. That one there is very serious. That one there is a colo pa.
And value cry low no dear.
Very low cry, and they're very dangerous. So
the low, checking us a lower, and they are more dangerous than so check high.
High in cry, they're saying that like it's like the damage usually is not instant. It's gradual, progressive. But like hypoglycemia can go like give you acute damages, that kind of thing. So when you go hypo, one of the earliest symptoms that you notice that you are going hypo, you begin to sweat.
You sweat. Because a hypo, just say
your blood glucose no. Hypo just say low. Hypo just say low. You can't hypo low. Hypoglycemia just say your blood glucose is low.
It's low.
Low. It's hypo. Hypo means low.
Okay, so doctor tell me that I'm hypo just why hypo and now be what you say.
Hypo just say low and you can hypoglycemia your blood glucose has gone low.
There's a quite a tiaba from cry.
Cry.
Then they are more dangerous.
Yes.
Now me pacho before because age be because my cousin me test my blood sugar. You know, I can go anywhere to test my blood sugar, right?
Yeah.
See me near ka say 3 point something. I just say
very low.
Very low, which is very dangerous. And
Yes.
now what can you na?
Yes.
And I said I just say see you na check you.
Oh, and I mean, like it's not very common. Say,
Okay.
like the starvation.
Okay.
When my own DBB or no alcohol near that, like your blood glucose can go low.
Yeah.
But it can be due to most of the time due to inrona over. So sometimes one of because of the management of diabetes, no, inrona on them, inrona be predisposed to the hypo, and I'm making one of my own DD. Because like it feels like the blood glucose will be persistently ever costly. So she also obey the dimple.
Okay.
So one of the earliest symptoms that make is begin to sweat.
Okay.
If you feel better,
so a coloa.
And see, even at the ward, no, for diabetic patients, one thing that very prompting say, let's go and check that glucose. Or begin to sweat. The patient begins to sweat.
Yeah.
That one I noticed that your blood goes getting low. Other thing, you begin to get very thirsty. At that point, the patient may get very thirsty, and then they have what is known as the neuroglycopenic symptoms. The end is when it gets very low, I begin to have some of these CNS symptoms. Obi and the blood glucose persistently low, no confusion to me beam. So begin to say hallucinate. The person begin kasa basa.
Okay.
Sometimes some of the diabetic patients, begin to be about them. And when they go into hypo now, because the person is going mad because there can be some of these neurogenic symptoms. No, kasa confusion. The person can lose track of time, maybe our orientation to place and time. Sometimes it may be due to hypoglycemia. So one of the earliest managed the value is now very low. To say that say less than say like 4, do 4 na like a because the person is going low hypoglycemic. At that point, the simple sugar is very important. So Coca-Cola or glucose powder, be of fear, which money be and fruit juice be simple sugars now.
Okay.
Manino baby na man blood glucose and embra. So before you even go to the hospital. To check. Every crana in no. Those night the man on find the correct dose. He's taking higher than usual, higher doses than usual. Some of the drugs can predispose you to that hypoglycemia. When you notice something like that, then you quickly rush to the hospital.
Wow, doctor. And I assume there too much. Meaning say diabetes the same way. Yeah, can't want someone and if you say more someone no more than it. Now come here with some last question say. So be I afa alcohol na wajaya. Still, alcohol no ebe no problem. Ama onya diabetes. Can that person check diabetes? My last question na.
Okay. So as I said already, alcohol is a risk factor for diabetes.
Okay.
And then the one of the major organs that the alcohol usually affects is the liver. Yes. And then the liver is a very wonderful organ.
Okay.
Liver can regenerate. Like especially if the insult to the liver is cut off. Okay. So if someone who has been taking a lot of alcohol, that has led to alcoholic fatty disease, and I say any other liver complication. Not your in term, your body the liver usually sort of
heal itself.
Heal on its own. And over time you notice that the liver works very fine. Because when the liver is affected, liver the main organ for glucose metabolism.
Okay.
Metabolism and when the liver is damaged, it can predispose you to the diabetes too as well. Okay. And I say some of the complications of diabetes can affect your liver too as well. And she say, a lot of alcohol now affects your liver now, it can predispose you. And if you jai, and lead you to some complications. Sometimes when you get to the stage of cirrhosis, you can even go back. So there are cases where it may advance you to the stage of cirrhosis. Not just say like a complication. Everyone says it's a complication. It can even revert back to normal. So what is important is that you get the help that you need as early as possible. So that's like that sometimes with vitamins and other healthy lifestyles. No.
And if I vitamins once a month, for diabetes, and all I'm at saying, type 1, no, you know, so no vitamins. I know so on this program we talk about vitamins a lot. So they na be recommend ya ma yen ene aduane ben na be ka recommend ya ma ye yie say ye be di emra ye nya bie ye be di emra ye nya bi na ye de bo ye ho ban.
So very important in terms of dietary supplements and food supplements, for patients with diabetes, the B vitamins are really important. The
Vitamin B.
Vitamin B is really important. So the B1, the B6, the B12.
B1, B6, B12. Okay.
All the B vitamins are important, but like most importantly, these ones.
Okay.
They're really important because they help with the nerve regeneration. They ensure that you have healthy nerves all the time. So usually, manum B vitamin, I mean,
Okay.
sometimes that you don't really notice the effects right now. It's over time. You have to take it for a while beforehand. So someone with diabetes, especially those on metformin, and that like it's important to regularly be taking the B vitamins.
Okay.
So for people with diabetes, other vitamins are very important. Like important to take, but make sure that take some of these dietary supplements and make sure that it has adequate amount of the B vitamins. Now, a woman very important. So the vitamin A, B, C, or like vitamin E, they are all really important. You understand? The ginseng. So the supplement that contains some of these ginseng, there were ginseng supplements. The ginger, onions, garlics, they are all really important to help with the blood circulation. Do you understand? Because of the link between diabetes and hypertension. So you have to ensure that there's adequate blood supply, blood circulation. To prevent some of these amputations. Sometimes the blood supply to the lower extremities to make cut short because of the damage to the blood vessels. Some of these diets need to make repair some of these things. And the diet, the complex carbohydrates is very important because most of the things we eat is yam, potatoes, plantain, and rice. Those are what we eat. So instead of eating the simple sugars, try to eat more of the complex carbohydrates. Incorporate more of that, and then add more proteins and vegetables. Fruit and vegetables are very important because of the fiber. So I'll just mention high intake of fiber. Fruits and vegetables contain adequate amount of fiber. Fiber with weight loss. So it's very good for a diabetic patient. So the fiber intake. So if you have any dietary supplement with fiber or like the fruits and the vegetables, they are very rich in fiber. So you can be taking a lot of them to help you. So basically that is. So there are a lot of things, but I can't say all right now. So,
you can say some.
I mean, like, so
you can say you can add more.
So I mean, like the fiber
this is a very important topic.
So another thing is to cut down your sodium intake or the table sugars. So they recommend that you reduce your table sugar. Very, very important. So
that is our normal sugar. White salt, sugar or table salt.
Salt American.
You have to reduce the salt.
Yeah, salt intake also predisposed. So you have to also reduce your salt intake too as well.
Spices.
Because the spices containing the salt. So sometimes you may think that you use salt at the go but spice near adding also to me NPC or very important say you check the spice and then there's until balance is say what they call salt, table salt, crazy. If you're any there, like you want to eat, you guys about diabetes men if you cut the person one money salt the food is not the person will not even enjoy what the person is eating. So it's not like it depends on the state of your condition though, but generally speaking, like you can take some salt, like but don't take too much so that at least the person will enjoy the food and then would want to eat more. If you are giving me food that doesn't taste nice, like I won't even want to eat it. But we want to encourage you to eat in order to get the adequate nutrients that you need. That kind of thing. So it's like if you need like you add the salt and all, but like not too much. Sort of reduce it, generally speaking. And then increase the fiber, more fiber.
I see. Now late eating. How does it contribute to diabetes? So me call you Maame buy my mantem my bread. Bobe 9. Matna me nkwa ho medidi. Medidi yen so ebia anche medi akoda. Betimi aha me wo diabetes betimi ayi ne ho and betimi aha me.
So the question. This has to do with the metabolism of the food, or glucose metabolism. When you intake calories, so that my energy, because glucose, it pushes into your cells now. It's how glucose undergoes glycolysis, they produce what is known as ATP. And energy, for active. So in a day, it's like generally try to ingest the calories that will meet the kind of activities you'll be embarking on that day. That kind of thing. So because if you take in so much calories and then you don't do a lot of activities to burn or use up these calories now, the rest will be stored as fat in your adipose. And then when you begin to store more fat, you begin to gain weight, and then the more fat you have, it reduces your insulin sensitivity to so as well. That's why the late eating is a problem. I won't say late eating is bad per se. Like generally speaking, late eating is not advisable. But someone who works late, or late, so the person is a minor, or call that day anaju. You can't tell the person say because because the person needs the energy to work at that time. But most of the time, people sleep at night. Like it's the night time that we sleep. So usually, if you eat late and go and sleep, that's not the problem. But if you are someone who work at night, don't say yes, so don't eat and you will collapse and die. So generally, it has to do with the consumption pattern, like the activity of the day, the kind of activities you are going to embark within that period of time. So we also have to check the kind of activities they are going to embark on the day. The brain itself consumes a lot of glucose. The brain consumes even the higher percentage of glucose already. Even that use a lot of brain power, you have to eat well. Like when you're studying actively, when you're thinking actively, you're having meetings, you're brainstorming, you're learning, at that point you have to eat well because the brain takes up a lot of glucose, that kind of thing. Or someone who is pregnant, you have to eat well. And late eating in there, and late eating is bad. It depends on the activities the person is going to embark on. So if the activities is such that you'll be able to use up that calories now while ingesting now, then you are good to go. But if the activity is such that now they are that the excess calories will be stored as adipose fat. Over time, you begin to accumulate a lot of fat, and that will reduce your insulin sensitivity. So generally speaking, late eating is not advisable because right after eating, usually you tend to go to bed or you tend to be sedentary. You don't do so much activity. So late in the evening, you can be doing some of these fruit shakes, salad. You can do salad, fruit shakes, smoothies, and other things. Like when it's getting very late in the evening, you are getting hungry. You can eat some of these things, or you can eat very light foods, so that it doesn't increase your a lot of calories. So eat food that does not contain a lot of calories. So in may now, maybe it's getting late. Because of your activities, it's normal. Like it happens. Like upon very late about don't eat too much. Just you can eat something, but preferably if you have fruits, these salads, you have smoothies near there, those will be preferred as compared to say obey. But just make sure that your caloric intake match their kind of activities you are going to embark on. That's basically.
Yes, and then so doctor, watch and your ma come for diabetes. I'm sure say wow shemine was ya dear papa visa me dear nedia mesua pa. In fact me sorry free na me di doctor achi na mama doctor kwakọ check me bibia said the ya me so say in case say me sugar no kosra what me aboa me ama me sugar na aba form say what ba dwumadie yi so a na o pese obusa question bia. Please, you can leave the question in my inbox, and then if you think that you want to see the doctor and it's urgent, how what's your doctor? Ope se wo hu na mesre wo se wo de wo ja wo number e wo ye inbox mu na ye ba na wo question bia say answer be answer na se ye frɛ wa wada roma ye be frɛ na wo so aba doctor ho na oni na ba di enkomo enya ade a doctor say ono ba be yes bia betua we na be wo de bra ye no di enkomo na ehunu se doctor hu se wasɛm no ehia se o ma wo tonura na waboa wo na ototo nuru fefefe se o ma wo kokko hu doctor bia na wa refer wa koma doctor bi na doctor no so ato adwumadie ne so na mo question bia how wa mesre say you can just leave your questions in my inbox and we'll come back to answer all those questions for you. You are watching My Health Checks. It's all about saving lives. And my honorable doctor is Dr. Bobson Ateko. I busia ye de dwumadi abanawie ya ne sa. Ne mom doctor o final word to omo a omo hwe. Atitiri omo a omo nya bie anase omo a omo nhwe omo ho so yi.
Okay.
That's
So omo ya diagnose of diabetes, especially diabetes and hypertension. It's very important say one kasa obenya so betumi a kasa obenya glucometer ofie.
okay.
Obenya one kasa glucometer ofie. Na wasenya BP apparatus ni bi ofie, especially the digital one na obi abetumi use no. Unya bi ofie so that you can be monitoring your blood glucose regularly and then be monitoring your blood pressure too regularly. Very important, especially those who have been diagnosed maybe pre-diabetes or diabetes. Please, if you can, you can get your glucometer, or if you live close to a lab or a pharmacy, like you can be going there regularly to check your blood glucose. That's if you can't afford to buy the device. You can be going to the pharmacy or a lab regularly to just check your blood glucose to make sure, especially if you've been diagnosed, because it's really important. Sometimes you may not notice it, but like there may be complications developing. There are a number of complications I didn't mention. It can cause vision loss. Diabetes can lead to loss of vision, can cause cataracts, you understand? Can cause diabetic nephropathy, can affect your kidneys, you understand? Can affect your heart, can affect your liver, can cause a lot of complications, peripheral artery diseases, can cause a lot of these atherosclerotic cardiovascular diseases, no?
Wow.
Like, so it can cause a lot of things. So it is very important to start checking yourself, especially if you're advancing in age, 50 years and above. Just regularly, you can be checking your blood glucose regularly. So,
Dr. Minchwano, obi ayi masutire se etimi kwa ma oba mawu.
yes, very good. Thank you very much. One of the major complications of diabetes in men is erectile dysfunction.
Okay.
So persistent hyperglycemia, like when you have diabetes, no one checking a year. I bet you cause erectile dysfunction, especially in our men. No?
Okay.
So some of normal raining between your bulk. There are a number of things that can cause erectile dysfunction, especially in elderly. But like it's important to try to rule out diabetes because diabetes, one of the complications is the erectile dysfunction to answer.
And etimi so ma sperm no low.
Like
my own produce
impotence, like is also one of the
things.
complications that
Oh,
can
okay.
So you notice some of these impotence. So like the complications are a lot, and then they are not pleasant. Like they are not very pleasant. Because like vision, it can like destroy your vision, like that kind of thing.
So when it's me and
sometimes gradually your vision can reduce with time.
Okay.
That is the complication. So
okay.
the blood glucose there, you don't want it to be persistently high. You want it to be in adequate range.
Okay.
So thank you very much. If you have questions, as Lily M A.K.A said already, you can leave them in the comment section, and then I'll attend to your questions as much as I can.
Yeah. Oh, all too soon. All too soon. We have come to the end of this episode, and the topic that we've just treated is diabetes. I hope someone more team in no. More the doctor Semono. Ever to makuma so. Na ya share your health so ye. Na ya check it. Ye ho. So on say to treat here. Me am te me nsa time to treat pa nti na the doctor can dey me free ha na maka na da me di na chi na maka kɔhwɛ me deɛ fi sɛ my health checks deɛ ɛbɛboa na agye wɔn kwa ebusua mo ankasa mo sonfo hema nie afro songstress Lily M me so hyia me nso a wotumi frɛ me Maame Colors dasɛnɛ ɛbɛsɛ ne ahyia makra mo ate